Usually, a lot of people in India do not really know about autism much. What exactly is autism?
Nowadays, we are majorly suffering autism neurological disorder in children. Physically, they present very well. Physically, they look very well. But mentally, there is no surrounding communication
And what are these early signs of autism? How can parents detect that children are autistic?
because of restless mind. Mind is not stable. Child is not respond to you means there is a problem in communication.
So, how do you differentiate between late talking to autism?
Early talking or early walking depends on our genetic nature. Some children they talk very delay. After 1.5 years, after 2 years, they will talk. There is no speech problem in autism.
How exactly a child is affected by autism?
Medicated pregnancy, one of the reason. The fertilization system is disturbed. Child development, nervous system development disturbed.
Some autistic kid comes to you. How do you treat them in homeopathy, especially?
Depend on their expressions, depend on their behaviors, depend on their severity, depend on their age. I'm not giving same medicine.
If the mother or the father of the child has some unhealthy lifestyles, can that be affecting the child's health as well?
Lifestyle is also
What is your exact examination process?
directly patient is not expressing their symptoms. It is my duty as a doctor. I have to take a detailed observation.
Kids with autism, usually they say that they are very highly creative. What is your take on it?
Creative people.
So how about kids taking antibiotics?
In India, our medical system is so much disturbed. Any medicine available in market openly, freely.
Hello all, we are exploring a very important and sensitive topic today, autism and homeopathy. In this episode, we have Dr. A.M. Reddy Garu joining us. He's a renowned autism specialist in India. He's also the first ever homeopathy doctor to be featured on the Forbes magazine cover and has also received the prestigious British Parliament Award. We'll talk about what autism really is, how homeopathy approaches treatment, and hear insights from experts and experiences from families who have explored this path. So stay tuned for more insights. Hello, all. Joining us today for the podcast, we have Dr. A.M. Reddy Garu from A.M. Reddy Autism Center. Hello, sir.
Hi.
It's a pleasure to have you today.
Thank you.
So, sir, when we think about autism, usually a lot of people in India do not really know about autism much. So, how do you exactly say what exactly is autism?
Generally, not only in India, even internationally also, people don't know about autism.
Yeah.
Nowadays, we are majorly suffering autism neurological disorder in children.
Hmm.
So, in children means autism means there is no mental communications.
Hmm.
Physically, they present very well. Physically, they look very well. But mentally, there is no surrounding communications and one-to-one communications. Whenever you are enter into the cabin, children don't observe you. They are having a severe attention problem that goes to autism. Autism means there is a poor or severe or no communications with surrounding, that is calling autism. It is a mutinism. It is a mental mutinism. My mind is mute. That is generally calling autism.
Okay, doctor. And what are these early signs of autism? How can parents detect that their children are autistic?
Generally, whenever the 1 year below children, infants, whenever seeing, they feel happy, they will see us also replying. So when they are not observing us, they are not focusing on only one thing or they are not focusing on any other thing. So there is a problem in the children, like that we have to think. Because of restless mind. Mind is not stable. So mind is always restless. That is the main root form or main platform for autism. When the mind is not restless, there should maintain connections with surroundings. So that is the reason only when suppose the two children are there. One children is responding very well when you spoken.
Yeah.
One children is not responding very well when you talking with them. So there is a difference in two children. This child is observing communications and responding very well to you. The child is not respond to you means there is a problem in communications. So then only you can find out this person may be having attention problem. This person may be having ADHD problem or autism problem, whatever may be. So that depends on the how severe restlessness is there. That is depend on this person is having autism or ADHD, like that.
Okay. So, doctor, every child is not same, right? So, for some children, they might start talking in a very early stage, and some might talk in a very later stage. So, how do you differentiate between, late talking to autism?
So very good question, Pratyusha. So some who is mentally active, who is mentally very fast, they talk very fast.
Okay, yeah.
They learn very fast.
Yeah.
They observe very fast.
Yeah.
So who is physically having lot of energy,
Hmm.
they walk very fast. They walk very fast. They talk very slow.
Yeah.
This one means early talking or early walking, whatever is depends on our genetic nature.
Hmm.
It is depend on the parents
Yeah.
lifestyle, it depend on the parents genetic style. So it is affecting on this one. Some children sir, they talk very delay.
Hmm.
Suppose after 1.5 year, after 2 years they will talk. So this is not autism. Talking is delay is not at all autism.
Okay.
So there is no speech problem in autism, but only because of mental lack of mental communications. So everything is good. They observe very well, but there is no communications through mind. So that we think it is autism. Delayed speech is a different.
Yeah.
Delayed speech children, they communicate very well mentally. They observe very well mentally. Their surrounding observation is 100%, but only the speech delay.
Okay.
That is a delay speech. Delay speech is a different. It is a physical problem. So mental problem is the poor mental communication goes to, that is autism. So there is a difference between delay speech and autism. So many parents are thinking delay speech, delay speech, delay speech.
Yeah.
Speech is coming from our mind.
Yeah.
Our mind is responsible for speech. How mind is there, speech like that.
Yeah.
When mind is not having communications, how they can speak? This is the actually so many parents are having lot of confusions. My child is having speech problem. My girl is having speech problem.
Yeah.
Speech means it comes from mind. So we have to see mind means nervous system.
Yeah.
Nervous system means it is the formation of the first cell in our body.
Yeah.
In pregnancy,
Yeah.
the mind is the first cell of our body. Means so through that only it comes generally. So when the mind is disturbed, when the nervous system is in disorder, then these type of problems are coming.
Okay, doctor. Since you mentioned about genetics, is it a genetic problem?
So many parents are thinking same like you. So many people are asking me. So autism is a genetic problem. All genetic problems are the genetically they disturb in RNA, DNA, or deeper cellular level. This one. So autism is not a disease. It is a disorder. Disorder means there is no coordination in mind and body. There is no coordination. There is no coordination surrounding your mind.
Yeah.
So any disturbances in the coordination in the nervous system, it is a coming neurological disorder. So it is not coming from genetics. It is not coming from relation marriage. So autism, ADHD, these neurological disorders are disturbances into the ordering system. So that is the reason. That's why these are not coming from genetics. So whatever the genetical problem, mentally retarded problems, or severe neurological problems, or organ failure problems in this one children. So those are the genetical problems. So that is a maybe relation. So autism is not at all related with the genetics, but it is related with it purely. There is only the functional disturbances. There is no any pathological disturbances.
Okay, doctor.
Only functional disturbances. So that's why autism is not at all genetics. Autism is coming from neurological disorder.
And what can be the early signs of autism?
Early sense means communications only. So when I am talking to you, you are observing me. So there is no problem.
Yeah.
So when I am talking to you, you are not observing me. You are thinking something. You are not attending my speech.
Yeah.
So that is the attention problem. In that attention problem, it is a severe is there. That is the autism. Generally, it is appears only children because nervous system formation from childhood onwards only. That's generally. So in adult, generally ADHD problem. Generally we observe in adult there is no means 2 to 3, 4 after 4 years autism won't come. Generally autism starts in the pregnancy only.
Oh,
It is depends on the parents' health condition. So many cases I am seeing. So many patients I am observing. When I will take the case, so I am feeling wonderful reasons behind of this problem. So because of reason only it comes. Without reason, so many parents are sometimes they will, sir, we are very perfect. We did not having any health issue.
Yeah.
So we are so this one. My first baby is also good.
Yeah.
Second baby there is no problem. But after 1 year, 2 years, I got a autism baby. What is the reason? Means in case taking, some cases, there may be health conditions of the parents, maybe father side or maybe mother side.
Yeah.
Suppose mother is maybe having a lot of abortions between the two pregnancies. That may be reason also. That may be also reason in the hormone disturbances. That is also one reason like that. So many, without reason, autism, ADHD won't come.
Got it.
So reason is means important. So that's why in homeopathy we treat root cause treatment.
Yeah, got it.
So we find out the reason. What is the reason behind of this? Why this baby is getting autism? So there compulsory there should be a reason. We have to find out this reason through case taking analysis.
And doctor, since you have been mentioning about ADHD, what exactly is that?
Attention deficiency is there. Attention deficiency, hyperactive disorder.
Okay.
Generally, so many children are hyperactive. Hyperactive means restless physically.
Okay.
Mentally, there is not much restless. Then mentally, they communicate well, they observe well. But physically, अब सब लोग बच्चे रहते हैं ना हाइपर करते हैं हाइपर कर रहे बोलते हैं फिजिकल रेस्टलेसनेस मींस हाइपरएक्टिव डिसऑर्डर when this hyperactivity at mental level that goes to ADHD because of mental restlessness, because of nervous instability, because of physical instability also. They don't have a longer communications with people, with the teachers, with the parents, with surroundings. So attention deficiency hyperactive disorder. Hyperactive disorder. It is a disorder. Hyperactive, active, hyperactive. Then these two are leads to attention problem, severe condition. That's why ADHD is calling attention deficiency hyperactive disorder. They are having a lot of knowledge, a lot of memory, but there is unstable mind. The mind is not stable, changing always, changing always, changing always. That is a calling hyperactive ADHD.
And are these different, doctor? ADHD and autism, are they completely different?
Actually, basically, hyperactivity, restlessness is the common platform for autism and ADHD. Without restlessness of the mind, without restlessness of the nervous system, there is no ADHD, there is no autism.
Okay.
These restlessness at mental level, it appears like ADHD. These restlessness at mental level severely appears, it goes to autism. Okay. So first of all, children are active. That is a healthy condition. This activity, it goes to hyper level, that goes to hyperactive. This hyperactivity at next level, at mental level, that goes to ADHD. These ADHD at severe level goes to autism. This is the way of formation of the disorder formation because of restlessness of the children. So it is like that we can categorize. All three are, we are telling combination of the ASD. ASD means autism spectrum disorder.
Okay.
So in that ASD, it is a restlessness. In that ASD, it is a ADHD. In that ASD, it is autism also. It is a spectrum. So many doctors are just, this boy is having ASD. They diagnose. But in deeper level, we find out this is autism or hyperactive or ADHD. Like that, we have to diagnosis like that.
And what can be the reasons for autism? Like how exactly a child is affected by autism?
So many reasons. Just I will tell that one patient is there. I don't tell the patient name. Medicated pregnancy. The child is having 5 years, 1 month. The mother, since 5 years, after marriage of 5 years, she did not get pregnant. She taken medicines. That is the reason. Then it is a formation of the autism child.
Okay.
So medicated pregnancy, one of the reason. Hormone pills taken for 5 months before conceive. After taken of hormone pills, so she got a pregnancy. That is one reason. So another reason is, so many reasons are there. Just I am for awareness purpose I am telling to you.
So does it depend on case to case?
It depends on the case to case. It is not a common reason. Is not a this one. Common expression is a restlessness. But reason is the different part. Some XXY patient 5 years 5 months before 3 months mother got appendix operation. Same gallbladder surgery also they did.
Okay.
After 2 to 3 months only she got a pregnancy because of surgery, major surgery. The health is disturbed. Correct. Maybe because of medicines, because of problem. Then immediately body is not ready for pregnancy. So they should take at least 6 months to 1 year time. This is the reason.
Yeah.
So autism, ADHD, whatever problems are there, it is a depend on the health conditions of the parents.
Yeah.
When the mother health is a perfect, father health is a perfect, there is no chance.
Okay.
And one more reason is also a mother is having severe vomitings up to delivery. Vomitings is not a reason here. She taken every day medication for vomiting. So medication she taken, the same medicines he applied to the child also.
Yeah.
Common,
Indirectly,
it is a common.
Correct. Yeah.
So because unwantedly child is also receive the medicine,
Yeah.
wantedly mother is receiving the medicine. So this is the reason the mother is also having low hemoglobin, 7% during pregnancy time. This is the reason. So this child is 5 years, 3 months.
Yeah.
Like that, just I am telling few examples,
of
this
course,
one.
doctor.
And another child, 3 years, 7 months, 8.5 year gap between the first child and second child.
Okay.
So for pregnancy, they used 10 tablets after medication. Because of 8.5 year, she
Age
did
gap,
not
yeah.
got a pregnancy. Maybe she went to some other doctor. They prescribed medicines. So this is the reason. First child is a good, second child got autism.
Okay. Yeah.
Like that. So many reasons. Each case and every case,
Yeah.
I will. Beautiful means the reason is important.
Yeah. Correct.
With this reason only we can treat all autism and ADHD cases.
Yeah.
Suppose one case is there, some XXY, 7 years male. After 1 year of marriage, irregular periods for 15 days period, medicines taken that this one, and in blister formation in the private parts also for mother, and 8th month pregnancy she got a sudden bleeding.
Okay.
For that also she taken medicines, cold medicines, cough medicines, antibiotics also she taken during pregnancy 2 times. So because of this reason, the child formation is disturbed. The fertilization system is disturbed. Child development, nervous system development, neurological system is disturbed.
Yeah.
So this is the reason. These types, so many reasons are there. I have a lot of study in autism and ADHD cases like that.
Yeah. Got it, doctor. And majorly, all of these were emphasizing on the mother's health, right?
Mother,
That
even father
means-
also, not only
Yeah.
mother here.
Okay.
Father is also 50% responsible. Some parents are thinking mother only responsible. Mother is not at all here. Even father's sperm quality is also responsible.
Okay.
Father lifestyle is also responsible. Suppose father is having everyday smoking. Father is taking everyday gutka or something pan.
Yeah. Got it.
Father is taking alcohol every day. That affecting their sperm quality.
Yeah.
So many, when father is taken medicines for sperm quality is also responsible. So if father, mother 100% perfect, organic health is there, there is no problem. 100% these type of problems won't come. Sure, I'm sure.
Okay, doctor. And can they get early detection? I mean, like before getting pregnant itself, can they check the sperm quality and everything, and then can they actually
Here
find out?
that sperm motility you can test it. You can't test the quality. Sperm is the deeper cellular system.
True.
You can't sperm quality you can't check it. Sperm motility you can check it. Sperm number count you can check it.
Yeah.
But we can't check the quality side. At the same time, autism, ADHD, there is no any laboratory examination. No scannings, no MRI.
Can't be found out.
Can't
through
find.
that.
Because physically we see.
Yeah.
But it is coming, it is not a problem, it is not a genetics. Even chromosomal test also comes normal.
Yeah.
Because it is not coming genetics.
Yeah.
So it is a coming purely clinical observation. One beautiful observation I will tell to all my, I asked my patients also, clients, patients. So whenever mother is having lot of movements, child movements in the stomach during pregnancy, regular movements, sometimes kickings are okay. Uncontrollable kickings, more kickings are the indication of the restlessness in the womb.
Yeah, got it.
Some mothers are expressing, sir, for 5th month, my child is kicking so much inside. It is very troubling me. My sleep is also disturbing. So child started problem there only.
Yeah.
Because restlessness started there only.
True.
So it is a clinical observation you can observe generally. After that, after this 1 year after this one, so restlessness, if it is more, so it is slowly improves.
Okay.
So like that clinical observation only you can observe these type of neurological disorders. There is no any laboratory blood examination. There is no any this one. Like that. Generally, there is no any only clinical observation. Any expert doctor, even MBBS doctor, is also can suggest. When pediatric doctor, when any doctor, they suggest easily these type of this one.
Okay, doctor. And doctor, whenever some autistic kid comes to you, how do you treat them in homeopathy especially?
So different autism children, different symptoms they express. Suppose 10 children we take an autism. Suppose in a room, in a big room. Suppose 10 children are there. So different they behave.
Yeah.
But commonly is the restlessness.
Yeah.
But expressions, behaviors are the genetical nature. Whatever.
Patterns are different. Yeah.
So for my medication, I can take a constitutional type of system. What is the medication? So for each 10 patients, I am not giving same medicine.
Yeah.
So depend on their expressions, depend on their behaviors, depend on their severity, depend on their age. So I decided my remedy.
Okay.
So it is a lot of study. Each and every case it will take a 40 minutes time, 30 minutes time.
Yeah.
It is not so easy. So because why? Because autism, ADHD, hyperactivity, there is no medicine in any medical system. So I am treating through root cause.
Yeah.
So that's why my success rate is very good for autism cases. I'm this one.
Yeah.
So it is depend on the case to case. It's not commonly you can't give the same medicines for same. In an allopathy system or other medication system, they will give common medication for all. It is not in homeopathy. Homeopathy differs case by case.
Okay, doctor. And majorly, I've heard that whenever the child has autism and when he or she grows up, the autistic behavior will naturally be cured. Is it real?
Basically, as you said, correct. Autism, ADHD, even not only you, every therapy centers, every doctor is also, it can't curable. It is like that only. You have to suffer.
Okay.
So by child is growing time, child is little bit 2%, 3%, 5% is better side, maybe this one. So through homeopathy, you can treat root cause treatment through immune system, internal immune system correction. I treated so many cases successful in this one.
Yeah.
So with homeopathy, so wonderful result is there, homeopathy through autism and ADHD cases. Why I am treating autism cases means I am treating root cause. I am not treating directly autism. So through root cause, I am catching that point. I am catching the reason. So from that only, my success rate is getting better side more.
So, doctor, they say that whenever a kid is growing older, the autistic nature of them will also be cured. Is it real?
No. It can't treat. It can't treat self.
Okay. So they
Because
should
already
do some-
system is disturbed.
Okay.
When I am seeing so many cases, 13 years, 15 years, 18 years, it is like that only. A little bit 5 to 2%, 3% only better side because of age process. But because all system is disturbed, we have to treat that disturbance. When the disturbance is going to treat it easily, then they will develop the self recovery.
Got it, doctor.
I've seen so many cases, ADHD cases, autism cases. This one, my patients are very much happy with my treatment. Sir, so many patients, 80% almost. I definitely say.
Yeah.
So after your medication, my child is speaking well, sir. After your medication, my child is responding very well. So homeopathy medicines are slow, but it treats effectively and permanently.
Yeah.
That is the only advantage.
Correct. And doctor, okay, when we talk about medications, right? Since you have been emphasizing on the medications, can pregnant women be affected because of these medications, and can that in turn affect the kid?
Generally, infertility or fertility is the nature system.
Okay.
It is a nature system. When all animals are not using any medicines, all birds are not using any medicines. So we also not supposed to use medicines. When you are using medicines, our original system going to disturb. Suppose during pregnancy you taken some hormone pills. During pregnancy taken some antibiotics. That is affecting your pathological, physiological process in your system. That is indirectly affecting on your kid during pregnancy time. So I'm strongly telling during pregnancy or before pregnancy, so there is no need of any medications. Medicines are the chemicals. It is like chemicals. If you are taking that chemicals, it disturbing your total system in your body.
Okay.
So that may be indirectly reason, that may be direct reason also to getting autism children.
And doctor, if we talk about someone like a woman who has, let's say, diabetes or who has hypothyroidism or something like that, so can their kids be affected because of these issues?
Definitely, I am seeing so many cases, a diabetic mother, diabetic father, diabetic thyroid mothers, thyroid this one. So here two things. One thing is the because of diabetes, ovulation process is disturbed.
Yeah.
Because of medication, child development is also disturbed.
Okay.
Two things here. One is the mother problem, because of mother problem or father problem, fertilization disturbed. Disturbed pregnancy, it is calling disturbed pregnancy. And one more thing is also because of medicines, unwantedly the baby is also affecting. That is also one reason. Because of these two reasons, definitely these children may be restlessness. That if it may be severe level, it goes to autism. It lower level restlessness there goes to physical level only hyperactive. Like that. It depends on the constitutional effect. How the child formation is there, how child is constitution is strong. If the weak constitutions are there, they affect very easily. When the strong constitutions, children constitutions are there, means they affect very less. Like that, it depends on the. It is depend purely luck.
Okay.
And you can't say compulsory a diabetic mother is getting autism children.
There are chances.
There are the more chances are there. More because disturbance is there.
Correct. Okay. And doctor, when we talk about the lifestyle of the parents, right? If the mother or the father of the child has some unhealthy lifestyles, let's say they're sleeping late at nights or have this alcoholic habits or smoking habits or all of that, can that be affecting the child's health as well?
Lifestyle is also one of the responsible, but not direct.
Okay.
Suppose here problem is the lifestyle is the there is no any disturbances in the health conditions. Only temporary. Suppose mother is not having proper sleep. Mother is watching more TV.
Yeah.
Mother is having any this one. So this lifestyle is not directly affecting or not reason for this type of problem, but already affected health conditions of the parents. Suppose mother is not having proper sleep. So why she is not having proper sleep? What is the reason behind of this? That reason is maybe chances are getting this problem. You got point?
Oh, yeah,
Just
yeah.
so we have to think behind of this problem. So mother is having lot of anger issue. Because of anger, the child definitely it affect.
Okay.
It definitely affect. When father anger, father emotions is also affecting on the sperm quality.
Okay.
Some fathers are they shout very loudly. Their anger is uncontrollable.
Yeah.
That is
Short-tempered.
also means our sperm is indication of our nature. Our sperm is indication of it is coming from our body. It is purely. Suppose some bad cases, some bad luck cases, I will tell to sometimes my patients. Before this pregnancy, at least 2 weeks. 2 weeks this pregnancy, 2 weeks or 3 weeks maybe, the father is having lot of antibiotics. For mother is taking lot of cough syrups or medicines. That is also because first day is more important. Formation.
Yeah.
It is the fertilization is the combination of the sperm and ovum.
Yes.
When the first day of the combination time, surroundings are the good means good. When the surroundings are the disturbed, here the nervous system is also, that's why planned pregnancy is important. So many parents, after 1 month they will get pregnancy after marriage. So immediately when lot of mental pressure, lot of these things are there, even though they will go direct for pregnancy within a month after this one. So planned pregnancy means before this pregnancy, you have to make a plan. After 6 months, I will get pregnancy.
Yeah. And
So
to maintain the healthy
maintain the
lifestyle.
health, sleep, lifestyle. What you are asking, lifestyle. So should not take any medicines. Everything is important. So child is a precious this one. So we can't say means it is not blindly this one. If blindly going means if you are not taking any medicines, it is coming naturally. Already you are taking some disturbances, you're taking some medicines means definitely it disturb. Are the disturbances, how much it is depend on the child constitution.
Okay. And doctor, apart from pregnancy time, like okay, once the child is born, let's say he's very early on, he or she might be like 2 years or 3 years old, and at that point of time, if there are heavy disturbances in the family, I mean like a lot of mental trauma or lots of let's say fights that are happening between the parents, so can that in turn affect the child?
What you are saying that may be demotivating temporarily, but that not affecting total permanent system.
Okay.
That is not a good. Suppose baby is there,
Yeah.
4 years baby or 3 years baby, the mother and father talking seriously, disturbing.
Yeah.
Child is getting fear or insecure,
Yes. Yes.
insecure. That may be demotivating, or that may be disturbances temporarily comes. Again after 2 days, mother talking well to child or father talking child, both child means it coming. It is reversible.
Okay.
So that is not affecting permanently, but it is a temporary disturbances. These temporary disturbances are not much responsible for this type of ASD problems.
Okay.
This
Got
is
it.
only temporary.
Yeah. And when we talk about autism, like since we know that every child is different and it hits every child differently.
Every constitution is different.
Yeah. So,
We are the combination. Suppose you are there, so your mother constitution is different, your father constitution is there. There is a both combinations you born.
yeah.
Then again you married. Your constitution is different, your husband constitution is different. Again your child is different. So it is a combination of how you are making. That depends on your health condition.
So, what can you exactly say if I ask about how many, like, what are the different types of autism or ADHD?
Generally, autism we category mild autism, moderate autism, severe autism. Mild autism, moderate autism, severe autism. Mild autism is a look like ADHD. ADHD is there is a word formation is there, not sentence formation. They observe very well, they don't express fully. That is ADHD. Mild autism is a little bit severe condition. They don't observe much more, but occasionally they will reply. That is a mild autism. Very occasionally also, not occasionally also, they don't express. That is a moderate autism. In severe autism, even they did not recognize parents. They did not recognize surroundings. They did not this one. They means there is no connections in someone this one. This is a severe autism. Depend on the clinical observation, we categorized mild autism, moderate autism, or severe autism. Like that. Autism is 3 types basically.
Okay. And how easy is it to cure someone with, let's say, okay, mild autism? Of course, it could be easier, but how is it like
It
dealing
is
with
not
some?
easier. It is not easier. It is
Okay.
autism is linked with mind.
Yeah.
There is no easy treatment for this one, because this is the in any other medical system they are hopeless. There is no medicine. Lifelong you have to suffer like that. They will explain. But mild is better than moderate. Moderate is better than severe.
Yeah.
Like
How
that.
difficult it gets when it's severe?
How difficult means?
I mean, like, how difficult is it to cure, or how much time it might take to cure
Mild
someone?
autism, it will take a 2 to 3 years, or maybe 6 months plus or minus. Moderate autism, 4 years compulsory.
Okay.
Severe autism, it may depends on the age. It may depends on the how much severity is there. It may sometimes, but within a 3 to 6 months, it will give. My medicine gives the relief.
Okay.
So many parents are saying, "Sir, 6 महीने हो गया हमारा." After 6 months, my child is little bit better. How much better means maybe 10 to 15% better. It is a good. Every year means with
Yeah.
medication it is coming better
A
means
little
it is
development.
a total life. It is not a problem. So you may be having lot of money, you may be having lot of good lifestyle, you may be having good parents, you may be having good whatever mother-in-law or whatever. But your child is autism means it is so much disturbing in your lifestyle. This child is your future. So if your happiness is missing, so that's why. So autism, ADHD, hyperactive cases, so right choice, right medication is important. So many parents don't believe homeopathy.
Yeah.
So many parents don't know about homeopathy. They must learn about homeopathy. They must know about homeopathy. They must think about homeopathy. Homeopathy is a very wonderful medication for neurological disorders.
Okay, doctor. And doctor, okay, if someone comes, I mean, like when the parents come to you telling about their kid, what is your exact examination process?
Clinical observation only. I
Hmm.
can observe clinically. I will take information for both parents,
Hmm.
from both parents,
Hmm.
what mother is telling. It is a very difficult process for me actually.
Hmm.
Here, directly patient is not expressing their symptoms.
Yeah.
It is showing.
Hmm.
Parents are expressing. Suppose the parents are maybe wrong expressions are there.
Hmm.
Suppose some whatever they think they express,
Hmm.
what actuality they don't express.
Yeah.
It is so difficult. It is my duty as a
Hmm.
doctor.
Hmm.
It is a so I have to take a detailed observation from
Hmm.
mother or from observation whatever maybe.
Hmm.
So it is my responsibility. I feel
Hmm.
sometimes parents they will tell their problems,
Hmm.
not symptoms of the kid.
Correct. Yeah.
Well, their problems are not important for me.
Yeah. Hmm.
Child symptoms are more important.
Correct.
So many difficulties in my practice to taking case. It is not so easy also.
Hmm.
Once I will take that's why sometimes it will take more time also for case analysis. It's a purely clinical observation only.
Hmm.
We have to take for right medication.
Okay. So, doctor, since you said that it can be mild, moderate, and in the extreme levels, how exactly a child behaves when it's like in a mild level, or how does someone behave in an extreme level?
It is just you can what is the observation level or concentration level or communication level,
Hmm.
you can score it.
Hmm.
Suppose mild is the 3 score,
Okay.
moderate is the 6 score,
Okay.
severe is the 8 9 score.
Hmm. Hmm.
Like that you can observation
Okay.
means clinical observation you can decide.
Hmm. Hmm.
Every child is look like a same. Basic is a unstable.
Hmm.
But with this instability, I have to calculate behaviors.
Hmm.
I have to calculate physical picture.
Hmm.
Physical
Hmm.
picture means what they are eating,
Hmm.
how they are sleeping,
Hmm.
how they are behaving.
Hmm.
Fear is there, anger is there. So many. So
Yeah.
these are the calculations I can calculate
Hmm.
by combination of all physical level and mental level and uh, problem level. So I can calculate and I will give the right medication for the child.
And so, when we have to talk about the behavior patterns of the autistic children, how can you exactly classify the behavior patterns of the children?
In my clinic, I observe in generally I observe in all children.
Hmm.
So different behaviors comes.
Yeah.
Behavior means normal behavior is different and abnormal behavior is different. Suppose parents are having lot of anger issue,
Hmm.
so child is also getting a little bit anger.
Hmm.
With this child, the
Hmm.
parents are disturbed. His health conditions with a lot of antibiotics or lot of over medications for acute problems.
Hmm.
So this behavior going into the double or triple or multiple side.
Hmm.
Anger means uncontrollable anger.
Hmm.
Some children I am seeing they are having a fear.
Yeah.
After using of medication, they will get panic fear,
Hmm.
severe fear.
Hmm. Hmm.
That is also behavior.
Hmm.
Some children are having uncontrollable. Uh, what is that? Talking.
Hmm.
Generally, they talk very well, nicely,
Yeah.
normal way.
Yeah.
After disturbed condition, after health conditions are disturbed, the uncontrollable system,
Hmm.
they will talk too much.
Hmm.
That goes to hyperactive.
Hmm.
So, we are seeing in society, some child is talking, 2 years child is talking like a 5 years child.
Yeah.
5 years child is talking like a 10 years child.
Hmm. Hmm.
So this is not a good actually. Active is a good,
Hmm.
hyperactive.
Hmm.
So hyperactive brain is not at all a good. They will fast. Everything is fast.
Hmm.
Memory controllable. Active memory is a different. Hyperactive memory is different.
Okay.
So 3 years means they talk like a 3 years.
Hmm.
They don't talk like a 5 years or 6 years or 7 years.
Hmm.
So over maturity is also disturbing in developmental system.
Okay, but in case if the person has very high IQ, I mean, we see kids with very high IQ now, so how do you classify that as?
So IQ and autism.
Hmm.
Actually, there is no relation for IQ and autism.
Yeah.
IQ means when you're having a deeper, longer memory,
Hmm.
thinking memory is there that goes to higher IQ side, whatever may be.
Okay.
In especially autism and ADHD cases,
Hmm.
mind is not stable.
Hmm.
So that's why IQ is not calculating.
Hmm.
IQ is only for when you in studies or in mathematics or this one we can calculate. Unstable mind, restless mind, we can't calculate IQ level. That is the first
Okay.
part.
Okay.
Another part is there whenever they are having a lot of interest is there children. Suppose some children are there in my Simon, they know very well about space related planets, but common sense is not there. So because of hyperactive brain, because of autism, whatever may be. So that's why we can't calculate IQ level for autism cases because IQ needs stable mind.
Okay. Yeah.
So here instability is there. That's why IQ we can't calculate. IQ is a different part.
Yeah.
Even normal child you can calculate IQ. That is a different part.
Okay.
You can categorize higher IQ or lower IQ. In autism children, this one whenever they are having a lot of interest is there, they will show good IQ. Whenever they are not don't have interest on particular thing, zero IQ.
Okay.
So IQ is not we can't calculate.
Yeah, sir. And so when we talk about, I mean, like, kids with autism, usually they say that they are very highly creative. What is your take on it?
Creative people is depend on the constitution. Some children are coming. So my child is writing very well. My child is drawing very well, very beautiful pictures. But the children is expecting lot of appreciations from parents, lot of appreciation from teachers. They feel happy when people are appreciating. So because of that, they creative mind develops self.
Okay.
But common sense is important. Whatever will be common surrounding communications, common surrounding connections, common observations are important. Without this common, the child is having lot of creativity means that is also ADHD.
Okay.
ADHD means whenever they are having an interest is there, they are focused on particular only one thing. The all things are they blocked.
Yeah.
Common sense is not appears. So that is not important. Creative, some children are creative mind, but over creative is without a sense of common things, it is not at all a good thing.
Okay, so since when we are discussing case studies, you've also mentioned about mother's health and she taking antibiotics as such.
Yes.
So how about kids taking antibiotics when at the very early stage when they take antibiotics? Is it bad for them?
In India, our medical system is so much of disturbed. There is no system. Even any medicine available in market openly, freely.
Yeah, over the counter. Yeah.
Over the counter, higher level of medicines. Even regular normal practitioner, registered medical practitioner is prescribing the same medicines. Even specialist is also prescribing same medicines.
Yeah.
So we are not giving value of our health. In our medical system is like that. So by using more medicines, we are suffering all chronic problems. You can see in India, anywhere you can go, lot of antibiotic, lot of medications wherever they used. In that area, lot of chronic problems are appears. Chronic problem is diabetes, thyroid, psoriasis, infertility, gastric issues, piles. Because we are natural system, we are disturbing unwanted medications over medications. So generally in foreign countries, in some countries, medicines are not available outside. Only doctor must prescribe.
Correct. Yeah.
With the doctor prescription only they will get medicines. Without prescription of doctor, this one they don't get medicines.
Yeah.
Conditionally they are available. So that's why their health conditions are so good compared with us. Go in Indian village, so many diabetic patients, so many thyroid patients. These are the nowadays common. Previously diabetes means diabetes we are thinking we are terrifying this one. But nowadays diabetes this one.
Yeah.
So over medication is not a good for our human bodies, especially for autism, ADHD cases. Suppose so many parents are telling, sir, 1 year my child is good. After 1 year, after 6 months, the child is behaving differently. Child is not communicating well with us. So I asked, what is the reason? What happened before 1 year means we used some medicines before first birthday. We admitted hospital before 8 months. After that, child health is disturbed. Till that child is better. After disturbances of medication, the child behaviors are turned to the worst side.
Okay.
So that's why for our bodies, medicines are not much required.
Hmm.
Any acute problem comes, 7 days is the maximum period.
Hmm.
Suppose child is getting loose motions,
Hmm.
give some home remedies.
Hmm.
Why you are giving antibiotics? Why you are giving medicines?
Yeah.
So body is getting self-immunization is
Yeah.
important. And child is getting cold cough,
Hmm.
give some time. Automatically body, it will take a healing system. If you are using medicines,
Hmm.
there is no healing power. Again, you depend on medicines. Every time child is getting cold cough.
Yeah.
Even North India, I am seeing so many cases. सर मंथली वंस इसको सर्दी खांसी होते रहता है.
Hmm.
कब शुरू हुआ उसको बोले तो आफ्टर 8 मंथ शुरू हुआ. 8 मंथ तक कुछ नहीं थे.
Hmm.
Once we started medication,
Hmm.
the same problem repeats again comes.
Hmm.
So wantedly we are doing mistakes.
Hmm.
So that's why antibiotics, over vaccinations are not at all good for children.
Yeah.
It is growing age,
Yeah.
should not disturb.
Correct. Actually, in search of faster remedies, we're destroying our own immune system.
Yes, yes. Our system is not. We are seeing parents, we are seeing grandparents, their parents, but so much of stories there behind of our generation.
Hmm.
Thousands of years, lack of years, we are coming from generation. We are not.
Yeah.
We are not coming from here only.
Yeah.
So we have to observe how our body develops like that. So unwanted, unethical medication, better not to advise to use.
Okay. Yeah, doctor. And when we talk about parenting styles, right? I mean, every couple or every parents have their own style of parenting. So, can we also classify bad parenting one of the reasons of autism?
So many autism mothers are I am seeing so nowadays they are suffering because father is blaming mother always
Yeah.
because of you only happening.
Hmm.
That is also wrong thing. Maybe father is also responsible.
Hmm.
Mother is having a lot of anger issues on children.
Hmm.
Mother is having a lot of anger issues on husband.
Hmm.
That is also affecting on child behavior.
Hmm.
But it is not direct reason for autism ADHD.
Okay.
Autism ADHD hyperactive, it is a disturbances inside, not from outside.
Hmm.
Whenever outside disturbances are there as a bad parenting or whatever they wrongly behave the parents or whatever is there, those things are the temporary disturbances.
Okay.
So these are the not permanently damaging system, but it is not a good.
Hmm.
That all children are, two things are important. One is you have to show love and affection, and you have to create fear
Hmm.
into children.
Hmm.
Important.
Hmm.
So उसको डरा के कंट्रोल करना, नहीं तो प्यार से कंट्रोल करना.
Hmm.
दो things है.
Yeah.
You can apply. So father behave like a principal,
Yeah.
mother behave like a teacher.
Hmm.
Nowadays what happened, only one child,
Yeah.
because of one child parents are insecure,
Hmm.
parents are getting fear more whenever child को सर्दी आ गया. So डर के
Overcautious.
next day दवा करके उसको डिस्टर्ब करे. So this is the bad parenting. It is not a good.
Yeah.
So compulsory means parents behavior is also important, but it is not directly affecting on children, but it is affect by indirectly.
Okay. And when we talk about therapies to treat autistic children, what exactly are the therapies that are
This is a
available?
common question for in my clinic. All parents are asking, sir, what therapies should I give? Given so many therapies not happening. Sir, therapies are so much better. Some friends are saying homeopathy treatment is not at all suitable to go for therapies. Therapies, what we'll do first? Therapies are only training system. How you train, they react. Suppose you come here, they react. इधर आओ बोले तो नहीं आएगा. Therapy is only limited scope. It is a good only, but it is a only supporting system, but it is only training part. It won't treat problem. Problem is there inside. We have to must focus on problem. Therapies are external support only. So through homeopathy, we are treating problem through root cause. That is the first important. Therapies, maybe if you are giving or if you are not giving, is also your choice.
Yeah.
Suppose with medication, child is getting better. Child mentally he is getting better means if you are telling also it is okay for you, for children. आप बोले तो भी सुनेगा.
Yeah.
उसका माइंड डिस्टर्ब है तो कोई बोले तो भी नहीं सुनेगा. थेरेपी से तो भी नहीं सुनेगा. They have to focus on first problem.
Yeah.
Then therapies, it is a support dependent on the parent, but don't expect therapies are going to treat problem. Therapies are not going to treat problem. Therapies are managing your problem. Therapies are supporting your problem. It won't treat your system. That's why therapies are okay, support.
Okay, got it, doctor. And okay, when some autistic child comes to your clinic and when they get the treatment done, do you also recommend some diet for them?
Really, diet is also one of the important. One more thing is also important for, I am advising all Indian mothers, Indian parents who is having beautiful children should not use any medication for children because gut issues are majorly impact on autism. Gut issue means it is not coming from parents. After disturbances of lot of antibiotics, after disturbances of lot of unwanted vaccinations, gut issues are going to develop. Gut issue means constipation. Every time they are eating, children, always snacks, or snacking system, uncontrollable hunger, over thirst, प्यास ज़्यादा बार बार को लगना, that is also gut issue, and offensive stools, motion is getting very bad, and whatever, even urine is also getting bad, eating more, these are the gut issues. These gut issues are the triggers, hyperactivity. These gut issues are the triggers the behaviors. These gut issues is also making double of autism. So that's why my advice, diet is very much important, but same time, do not disturb their gut system through unwanted medication. This is my advice to all Indian parents. So many parents are they don't when loose motions हो गए तो दवा देते फिर constipation शुरू होता.
Yeah.
So the parents don't know. Medication is the normal nowadays. Medicines are it is a chemicals. Organic life is important, not medicated life. So like that, some children are taking lot of sugars. Some children are taking lot of milk. Sugars create more hyperactive because of over energy food. That's why do not take sugars much. Milk is production of hormone system of animal. Mother milk अच्छा रहता, लेकिन गाय का milk it is not a good. गाय का milk गाय के लिए अच्छा है, आपके लिए अच्छा नहीं है. Mother milk is good for you. So by misconception, good milk is good, milk is good.
This is very common misconception. I mean, parents even beat kids for not having milk.
So milk is the direct hormone production of animal system. So it is a lactose intolerance. That's why milk is not at all good for kids. When normal kids also, it's not good. Milk is not at all good. Mother milk 1 year तक दे दो चले. There is no this one. After that, animal milk is not suitable. ऐसा हमारे को आदत दिलाया दूध अच्छा है, दूध अच्छा है, दूध अच्छा है. It is not at all good. Give good food, healthy food, timely food, important.
Yeah. And doctor, there will be a lot of patients coming to your clinic on daily basis, right? And also there will be a lot of VIP patients who keep coming up. So, I mean, do you treat them in a very different way, or is it? Do you charge them in a different way? How is it like?
VIP is every patient is a VIP. I don't consider their positions. I don't consider their payments. I don't consider their recommendations. I don't like all this one. In front of my patient is there means honestly I have to treat my patient perfectly. That is my ethically, dedicatedly. So VIP is every patient is VIP for me. Suppose a lot of cinema actors, children are coming. A lot of political children are coming to me. So because it is disturbing for again recommendations. What doctor needs correct case presentation. When the recommendations are there means the case presentation is going to disturb. They don't tell proper case presentation. That's why I don't like I don't encourage also any VAP system. Every patient is very important for me. Even they are economically poor or they may be economically rich. I don't at all consider that part. That is I follow ethical system for that.
And doctor, like, okay, in India, especially in the southern part of India, when we consider about marriages, a lot of marriages also happen within family. You know, cousin getting married to another cousin. Does that impact child's health as well?
Generally, because genetical similarities are there, na? Why we are means genetical similarities are, it is affecting on future generation. Definitely.
Okay.
This is opposite genetical system is good for body. If you marry opposite caste person, if you marry opposite unknown personality, it is a combination is a good. Our generation is started that only. When the genetical similarities are there, the same genes you have, the same genes in your family also, that person is also having, means these chemical similarities are the disturbance to create next generation.
Yeah.
So that is not at all advisable. So some cases, if maybe they will get good children also, no issue, that not compulsory, but it is not advisable. Different when caste wise is also different genetical this one, it's a combination. That's why America, why America is a lot of, why lot of people are having talented people in America, because America is a combination of all countries,
All races together.
all religious together.
Yeah.
It is not a this one. So different generations, different genetical combinations are the good for future generation.
Yeah. Thank you, doctor. Thank you so much for joining us today. And I've learned so much about autism, and I'm sure it's going to help all the audience out there. Thank you. Thank you so much for the deeper insights.
Thank you. Thank you.